So management, because in all that you are doing, you have to also learn how to manage the patient. So the enabling objective says conduct an effective initial management plan, including number one, evaluate airway, breathing, and circulation while initiating cardiopulmonary resuscitation using basic or advanced life support measures as appropriate. Basically, you have to understand ACLS so far as drowning is concerned. Number two, you must know how to activate emergency medical and or critical care services. And number three, you must continue cardiopulmonary resuscitation and other treatment to support organ perfusion while concomitantly treating hypothermia. So that's a lot of information in one enabling objective. And we're going to take our time as a class to break it down so that when we meet a case of drowning, none of us will be beaten. Please, are we all on the same page? Yeah. Okay. So, what is the next best step after retrieving a patient who is drowning? The next best step after receiving or retrieving a patient who is drowning is to check the airway, to check the breathing, to check the circulation. So, in a patient who is drowning, your next best step is A, B, C. Dr. Ras, you said rescue, but the point is, what's the next best step after retrieving? Retrieving. So that is, after retrieving a patient who is drowning, right? Yeah. So you've got to do your ABC. Now, after your ABC, what do? You have to place the patient on a cardiac monitor. So assuming you do your ABC, airway, breathing, and circulation, everything is fine. They have to place the patient on a cardiac monitor. Get IV access. Get CPAP, BiPAP, or intubation with ventilatory support if oxygen delivery is poor. Okay? So next best step after. So you retrieve somebody from the water body. Next best step, check ABC. After you check ABC, what do? If you're in a hospital setting or if you are in the ambulance, you have to make sure you get an IV line. You put on your cardiac monitoring quickly, okay? And if you can intubate the patient there and then, you do that. Okay, good. Let's move on. Patients who drown can present with arrhythmias, that is abnormal heart beating. Usually they get arrhythmias because of three issues. Number one, low oxygen supply. Number two, low body temperature, that is hypothermia. And number three, acidosis. So if I should ask you, why do patients who develop drowning get arrhythmias, get irregular heart rates or irregular heart beating? You've got to be able to tell me because of low oxygen supply, because of hypothermia, and because of acidosis. These three things. These are the three reasons why patients who drown develop arrhythmias. So when you have a patient who has been rescued from, a water body or something as a result of drowning, what should you make sure? You make sure that the patient is receiving adequate oxygen. And because hypothermia can also cause arrhythmia, you want to remove the wet clothes and cover the patient with a warm blanket. So always remember, what are the things that can cause arrhythmia in a patient who just drowned? Low oxygen supply, hypothermia, acidosis. Therefore, what should I do when I get a patient out of a water body? Number one, I need to make sure the patient is receiving adequate oxygen. Number two, I need to make sure that the wet clothes are removed. So when I'm removing the wet clothes and putting on the warm blanket, it's not just because the patient is shivering. Of course, you've got to cover them, but it's also as a result of the fact that you want to prevent arrhythmias. You want to prevent arrhythmias. Okay. So in a drowning patient who vomits, think about the possibility of aspiration. So if you see drowning, vomiting, what should be your next best step? Your next best step is to pass an NG tube, nasogastric tube. In a patient who drowns, who starts to vomit, think about the possibility of aspiration. And because there can be aspiration, what am I going to do for the patient? I'm going to pass an N and a G tube, NG tube, nasogastric tube. So vomiting in drowning, what is my next best step? What's my next best step?
NG tube.
NG tube. Okay. As soon as I pick out a patient from a water body, what's my next best step?
ABC, airway
Okay.
breathing
After
circulation.
ABC, what's my next best step?
Monitoring and
Cardiac monitoring,
Monitoring.
IV,
and
Beautiful.
CPAP, BiPAP.
Beautiful. What are the three
Warming.
reasons why patients get arrhythmias in drowning?
Hypoxia,
arrhythmia,
Hypoxia, acidosis,
and hypothermia. Beautiful. Okay.
hypothermia.
In a drowning patient who has a seizure, what should you do? Remember that we said that seizures can occur as a result of hypoxemia. So when you have a patient who drowns and starts to seethe, you've got to start thinking about low oxygen supply to the brain. And therefore, let me start giving oxygen. And while I'm giving oxygen, I'm going to also get my benzodiazepine like lorazepam. So, there are some nuances and some funny things that you need to know about drowning. If I have a patient who is drowning and the patient starts seizing, of course, I'm going to get my benzodiazepine. But one other thing I need to make sure the patient is getting is oxygen, because it could be that there's some hypoxic encephalopathy going on. And then what about if I see a patient who drowned and is wheezing? They are wheezing. What do? I have to give a bronchodilator. So you need to know these unique situations so you can be able to, better manage your patients. And should I give antibiotics or not? Don't be tricked in the exam. Remember that in Canadian exam, there's a concept you call choosing wisely. Choosing wisely. So should I give antibiotics prophylactically or not? No. If a patient drowns in seawater, don't give antibiotics. If a patient drowns in lake water, don't give antibiotics. If a patient drowns in river, don't give antibiotics. The only time you will give prophylactic antibiotics is because that water body the patient drowned in was contaminated and dirty. And number two, the patient drowned in a hot tub, not hot TB, hot tub, because of the risk of pseudomonas. That is when you are going to give antibiotics prophylactically. But if you see giving antibiotics prophylactically to a patient who drowned in clear running water, no. It's a wrong choice. But if the water was contaminated, then you give your antibiotics. Doctors, is it clear?
Yes.
Yes.
What of
Beautiful.
drowning in a swimming pool?
Sorry, I didn't hear the question.
Drowning in a swimming pool.
Yeah, if the swimming pool is clear, there's no need to give any antibiotics. The only time you give antibiotics is number one, if it is dirty, contaminated water, and number two, if it happened in a bathtub which has the risk of pseudomonas infection. Those are the only two reasons. Don't forget, it's also a board exam. What about cardiac arrest? Cardiac arrest in a patient with drowning. You've got to start CPR, cardiopulmonary resuscitation, right away, even if the patient's temperature is low. And then what you do is that as you do your CPR, you cover the patient and you start putting in measures so the patient's temperature can come up again. So if the patient is found to have cardiac arrest, continuous cardiopulmonary resuscitation while you try to warm the patient up.